the PANGEA study, which again was a multi-arm study trying to personalize treatments to every patient, getting an individualized therapy based on their own tumor biology, one of 8 molecular groups, which we reported first a year or two ago, and then more recently we published with some updated data. And the updates were essentially longer follow-up. And so the median follow-up time was more than 2 years on this study. The study started in 2014. And the primary endpoint of survival in that study at 1 year was met. And so that was reassuring that the PANGEA strategy, personalizing therapy to our patients, was beneficial compared to historical control, and supports assessing this in a prospective manner. And the median survival of patients with stage 4 disease treated with this PANGEA strategy was almost 16 months, which is pretty good for this disease. The median survival of HER2 positive disease is around 13 months in this TOGA study. And even with the recent Checkmate 649 study, for example, the median survival was about 14 months. So there were subgroups of HER2 being one of those 8 groups. There was a subgroup of immunotherapy. It was one of those 8 groups, but there were other groups, including FGFR2, MET, EGFR, and then sort of relegation arms for patients who didn't have those higher tier biomarker groups. And in fact, we put in the paper that was published this year now in February in print, that, it's sort of timely in the sense that we have a lot of options coming online now for first-line therapy. And there is a lot of overlap in terms of patients having more than one choice. And this study was sort of envisioning that years ago when it started, that in that setting, we'd want to know what to do. And this study was testing this prioritized algorithm prospectively to say, if a patient could fall into more than one group, we would prioritize them towards the one that we thought would be more beneficial to the patient, and do that repeatedly over up to 3 lines of therapy, so to try and keep up with the cancer. So those were the updates, that basically survival was extremely good, and that this persisted across each of the subgroups that were included. And then the last part was that the patients that were enrolled and assigned to the higher tier groups in the prioritization algorithm did better than the ones that were put into the lower prioritization groups. And we wanted to show that, because then otherwise, why are we prioritizing if it doesn't make any difference? But it did make a difference, and the survivals were almost double in the patients in the top 4 groups compared to those in the bottom groups. So that's the PANGEA study that's now completed and published.